everyone, and welcome back to another video. So today's video, guys, is going to be Pilates for scoliosis. Now, scoliosis is something that affects 2 to 3% of the population, and it is an abnormal lateral curvature of the spine. So we all have natural curves through the spine. So our neck will come in for a curve, our thoracic spine comes out, and then we tend to then have another inward curve for our lumbar spine, and that is a normal curvature of the spine. It needs to be like that in order to be able to function and in order to be able to move. Now, when we have a scoliosis, instead of the curvature being this way round, it is that way round. So you may see that the spine comes out to the shoulder blade slightly and then around to the opposite side. So that S shape is around the opposite way. Now, in order for it to classify as a medical diagnosis, the curvature needs to be above 10%. So we often feel that we are in discomfort and in pain in under that 10%, and an osteopath or a physiotherapist may diagnose a scoliosis as well, but it won't be medically treated unless it is over that 10% mark, and then it would be put into a category as to how extreme it is, as to what sort of treatment you will have done for it. Often, sometimes people will have rods put through if they're in that really extreme positioning, or they may just have kind of stability sections put through the spine there as well. So there is kind of surgical options for if you are in that kind of extreme curvature. If you're not though, we can get those muscles nice and strong to support the spine and to bring the spine into as much of a neutral position as we can, bearing in mind that we have that lateral curvature. So we want to make sure that we work both sides evenly, even though we may have that sort of length on one side and that shortening on the other side. We do want to make sure that we work both sides, but just being aware of the curvature throughout the workout and just thinking about trying to lessen it if we can as we go through. I'll kind of talk you through it as we go through each exercise as well. But yeah, so I guess we should get into the video. I also just wanted to say, guys, make sure you check with your healthcare practitioner before going ahead with this workout. And if you feel any pain or discomfort during the workout, then do stop the exercise or check your technique and go ahead from there. All right, guys, now we'll get into the video. Alright then, guys, we're going to just start off with some breathing. So we're going to place the hands onto the rib cage, and we're actually going to do some alternate rib cage breathing. Now, this one is really, really important for scoliosis, as we do often find that one side of the rib cage is a little bit more restricted than the other. So if we can work to open that out as much as we can, then we can find that we can get a little bit more comfort through the spine with that breath. So placing your hands onto the front of your ribs, your middle fingers are just gently touching and connecting. And we're just going to start off by coming into both sides of the rib cage. So we're going to take a deep breath in, feeling both sides of the rib cage expand evenly out as much as you can. So your fingertips will just gently slide apart from each other. And then breathing out, softening your chest, your breastbone, closing the ribs all the way down. So the fingertips slide back in towards each other, and then just see if you can get them to go ever so slightly past each other. And again, we're going to take that deep breath in, feeling the rib cage expanding out. Fingertips just gently sliding apart. And then breathing out, softening your chest, your breastbone, closing the ribs down. And then again, just seeing if you can just get them to slightly pass each other with those fingertips. Now we're going to come into the right side of your rib cage from there. So we're going to breathe in, feeling the right side of the rib cage expand. The right fingertips slide away from the left. Depending on the shape of your curvature, this may be much more challenging. Exhaling, softening your chest, your ribs, your right fingertips then slide back in to the left. Breathing in now to the left side of the ribs, so the left fingertips slide away from the right. Breathing out, softening your chest, your breastbone, as we feel the left fingertips then slide back in towards the right. Now back into the right side. Take that deep breath in. Feel the right side of the rib cage expand out. And then breathing out, softening your chest, your breastbone, closing that right side all the way down. And then into the left, breathing in, feel the left side of the rib cage expanding out. The left fingertips slide away from the right, and then breathing out, closing that left side down. And feel the fingertips, or the left fingertips, slide back in towards the right. Now just coming back into both sides, so taking that deep breath in, feeling both sides of the rib cage expand as evenly as we can. The fingertips slide apart. Breathing out, softening your chest, your ribs as we close the rib cage down. The fingertips slide back in towards each other, and then one more here. Take that deep breath in, feeling the rib cage expanding out to the sides and to the back. And then breathing out, softening your chest, your breastbone as we close the fingertips all the way down and just sliding them back in towards each other. Alright, so we're going to lengthen the arms then back down alongside you from there. And we're going to take that into our bridging. So no cushions or anything behind your head for this exercise. We want to be nice and flat onto the mat. Now we're breathing in to prepare. Press down into both feet. We've got that imaginary rod running through the spine. And we're going to plank the spine up. So we're lifting up as one piece. Pause here, breathing in. Fold at the hips as we plank the spine back down. Breathing in to prepare. Press down into the feet as we plank the spine up. Pause here, breathing in. And then fold at the hips as we plank the spine back down. Inhaling, exhaling as we lift. Pause here, breathing in. And then breath out as we plank the spine back down. Inhaling, exhaling to lift. Now we're going to stay lifted, pause and breathe in. Now step on to your left as you then draw your right knee into tabletop. And you're checking here those hip bones are staying nice and level. Now place that right foot down as you breathe in. Now transfer your weight into it as we then lift the left. Again, keeping those hip bones nice and level. Breathing in to lower. Step on to the right as we lift the left. Inhale to lower. Step on to the right as we then lift the left. Breathing in to lower. Let's do 4 more. Breathing out to the right knee lifts up. Inhale to lower and then lifting through the left. Again, hip bones staying level, abdominals pulling in. Breathing in, we've got 2 more guys. The right knee lifts up. Breathing in to lower and then last one over to the left. Place the foot down and then we can plank the spine back down from there. Alright guys, we're going to take it now into a little one leg circle. So we just want to think about the pelvis being nice and flat and nicely relaxed and released onto the mat. And just as even as you can on both sides. Again, depending on the severity of your scoliosis, you may feel that you have a little bit of a lift through the hip. But just try and get the hips to be as relaxed as we possibly can and nice and heavy on both sides into the mat. Now from here, we're going to breathe in. Pop your hands onto the front of your hips. We're going to stand onto the left foot as you draw that right knee into your tabletop. And we're just going to take it into a tabletop or one leg circle. So you've got a pencil on the top of your knee and you're going to draw a circle on the ceiling with your pencil. So taking the knee out to the side, check here that left hip doesn't lift off. Draw all the way around, across the body and away. And again, out to the side. Drawing all the way around with that circle and through. So we're just going all in one direction to begin with. And we're checking your hip bones are staying steady and connected. Abdominals are pulling in. And just check that left knee is still pointing up to the ceiling. That often wants to go a little bit walkies with this one as well. We're going to go for another 2 here. And then we're going to change the direction. All right, so we're going to go around the other way now. So we're going to bring the knee in, down, around, abdominals pulling in, maintaining that neutral. In, down, around, and circle through. So just thinking about stirring your thigh bone within that hip socket, just trying to create a little bit more mobility with each kind of rotation. Abdominals, again, as always, maintaining that connection. So just double checking that there. We've got another 2. And circle around, and then last one. All right, and then popping the foot back down. Now we're going to do the other side. So stand on to that right as we then lift the left knee up. You will definitely feel one side is more challenging than the other with this one as well. So we're going to take the knee out to the side, down, around and through. So again, just drawing that circle on the ceiling with your pencil on top of your knee. Keep your right knee pointing up towards the ceiling all the time. So a little bit of a top tip there. Think about your big toe, little toe, and the heel of that right foot staying connected into the mat all the time here. And maintaining that abdominal connection, of course. All right, let's go for another 2, and then we will change direction, guys. Good, good work. Okay, around the other way. So we can come across the body, out, around and up. Taking the leg across, down, out, around and up. And again, just maintaining that abdominal connection, trying to keep the pelvis heavy again on both sides into the mat. It's easy to have a little wibble wobble with this one. I'm definitely feeling that I'm having to maintain a little bit more connection on this side. This is my more challenging. Last couple. And then last one here. And have a relax. Good. Just give those knees just a gentle pull in towards the chest. Right then, guys, so we are going to come onto our sides. So depending on the side of your curvature, you will feel that you want to kind of collapse down into the mat here. And we want to just make sure that you're keeping that little bit of a lift through that underneath waist as much as you can. So we're trying to allow this spine, the top side, to lengthen out, and that underneath side just to connect in a little bit more rather than letting yourself collapse down. All right, so just finding that connection. Now you can pop a cushion or a block underneath your head as I am, or you can go with your arm underneath your head. So just go with whatever is most comfortable. So legs in that nice long line, reaching your feet from your head, shoulders, hips are stacked up. We're then going to do a little sneaky hinge at the hips and bring the feet forwards towards the front of the mat. So we've then got that little bit of an angle coming into the front of the hips. So from here, we're going to flex both feet, and your top leg is just going to lift so it is in line with the hip. Now we're going to do 2 kicks forward. So we're going to kick forward a 1 and pulse 2. Now we're going to point the toes, lengthen the leg bone as you draw it back and behind you. And you're checking here that you haven't let your waist collapse down. You're maintaining that connection. Flexing the foot. Inhale, 1 and 2. Breathing out, point the toes, lengthen the leg, keep those ribs sinking in, abdominals connected as you take the leg behind. 101 things to think about, I feel. Flex the foot, inhale, kick 1, 2. Breath out as we point, lengthening the leg bone back and away, and again flexing. Inhale, 1, 2, breath out to point, lengthening the leg bone back. We're going to go for 1 more, guys, flexing. Inhale, 1, 2, point the toes, lengthening the leg bone back. Now keep the leg behind you, take a breath in, little circles. 8, 7, 6, 5, 4, 3, 2, 1, a pause, change direction. 8, 7, 6, 5, 4, 3, 2, 1. Flexing the foot, little pulses up. 8, 7, 6, 5, 4, 3, 2 and 1. And then stacking the legs back up. Good. Right, now we're going to straighten the legs back out, so we're in that nice long line again. Feet reaching from the head. Again, just check we're not collapsing that underneath waist down into the mat. And we're going to come into some top leg lifts from there. So breathing in, and that top leg lifts just so it is in line with the hip. Flex the foot, push through the heel, and slowly lower back down. Top leg lifts up, breathing in. Exhaling to flex and lower back down. And then again, top leg lifts up, flexing and lowering back down. One more, top leg lifts, flex, lengthen and lower back down. Now we're going to add on, so top leg lifts up. Now the underneath leg lengthens. You're going to lift it to meet the top leg, squeeze those inner thighs, check we haven't collapsed that waist down, flex and lower back down. So that top leg lifts up, the underneath leg lengthens. Now keep that underneath waist lifted as we lift it to join. Squeeze those inner thighs, flex and lower back down. And again, top leg lifts up. Exhaling, the underneath leg lifts, flex and lower. We've got one more to go. Top leg lifts. Exhaling, the underneath leg lifts, flexing and lowering back down. Good. All right then, guys, we are going to have a little twizzle over to the other side. So we'll start off with our side kick. Legs in that nice long line, reaching your feet from your head. Shoulders, hips are stacked, eye line looking straight ahead. Again, you can pop cushions or a block underneath your head, or you can go with your arm, whatever is most comfortable. So from there we can hinge at the hips and bring the feet forwards towards the front of the mat. So we've got that little bit of an angle coming into the front of your hips. So flexing both feet to your top leg lift so it is in line with the hip, checking that we're keeping that underneath waist lifted all the time. So we're breathing in, kick forwards, 1, 2, breath out as we point, lengthening the leg bone back and behind you, opening through the hip but keeping those abdominals and ribs sinking. Flex the foot, inhale, 1, 2, breath out as we point, lengthening the leg bone back and away, and again flexing, inhale, 1, 2, breath out to point, lengthening the leg bone back, flexing the foot, inhale, 1, 2, pointing, lengthening, abdominals staying connected as we draw it back. 2 more to go, flexing, inhale, 1, 2, breath out to point, lengthening the leg bone back, and a last one, guys, flex the foot, inhale, 1, 2, point, lengthening the leg bone back. Now keep it behind you, breathing in, little circles, 8, 7, 6, 5, 4, 3, 2, 1, a pause, breathing in, change direction, 8, 7, 6, 5, 4, 3, 2, 1, flex the foot, little pulses, 8, 7, 6, 5, 4, 3, 2, 1, and relaxing back down from there. Beautiful. Okay, reaching the legs back now, so we're back in that nice long line. Shoulders, hips are stacked, eye line looking straight ahead. So top leg lifts up, make sure that underneath waist is staying lifted. Flex, push through the heel and lower back down. Top leg lifts up, breathing in. Exhaling to flex, really lengthen and lower back down. We've got 2 more. Top leg lifts up. Exhaling to flex and lower, and 1 more. Top leg lifts. Exhaling to flex and lower back down. Okay, let's add in those inner thigh lifts. So top leg lifts up. The underneath leg lengthens. We're lifting it to meet. Squeeze those inner thighs. Keep that underneath waist lifted. Flex and lower back down. Top leg lifts up. The underneath leg lengthens, lifting it to meet. Squeeze those inner thighs. Flex and lower back down. We've got 2 more. Top leg lifts up. Exhaling, the underneath leg lifts. flex, and lower back down. One more, guys, top leg lifts. Exhaling, the underneath leg lifts, flexing and lowering back down. Good, lovely. Oh, well done, guys. All right, we are going to have a little roll onto our fronts now. We're going to come into a little bit of extension. So the legs are going to come into your hip distance apart, and hands are just going to come to each side of your head. Now, if naturally you want to kind of come into one hand forward or the other hand forward, that is absolutely fine. Just go with where you feel comfortable. Depending on the severity of your scoliosis, you may feel that you can't quite get the hands even. That is absolutely fine. Just go with where you are comfortable laying on your front. So, pubic bone is sinking into the mat. Tummy muscles are actively lifting away. Now, we're going to shrug the shoulders up. Slide the shoulders all the way down. So almost imagine sliding your shoulder blades down into some pockets on the back of your t-shirt. From there, we're going to push into the forearms. Keep those shoulders sliding down as we extend the spine slightly, keeping that lift through those abdominals. So you're not dropping into the spine. You're keeping that lift and that connection all the time. Pause and release back down. So we shrug the shoulders up. Slide the shoulders all the way down. Again, shoulder blades into your pockets, pushing into the forearms as we extend, keeping that lift through those tummy muscles. Pause and slowly releasing back down. Shrug the shoulders up, sliding the shoulders down, pushing into the forearms as we extend. Pause, breathing in and a breath out as we slowly lower back down. Two more, guys, shrugging up. Slide those shoulders all the way down. Really connect into those lats as we push into the forearms to extend. Pause and releasing back down. Last one, guys, shrugging up, sliding down, pushing into the forearms. Pause and then releasing back down. All right, when you're ready, we're going to have a sit back, just have a really quick shell stretch and a release off. And then we can uncurl back up from there. So we're going to come onto all fours for our last two, guys. So knees are underneath the hips and the hands are directly underneath the shoulders. Now we just want to find our neutral positioning, so we can just go into that small arch and that small curl and then settle halfway. Shoulders are just sliding down, abdominals are staying fully connected here. Now from here we want to maintain that neutral positioning as much as we can. So we're breathing in. As we breathe out, we're going to slide the left leg along the mat and the right hand. We're going to lengthen them away and just gently lift into a small hover. Now you're checking that you're not letting your spine drop or arch or twist. You're trying to maintain that neutral position as much as we can. We can then slide back in. Now the right leg, the left hand slide along. You can keep them down in contact, but if you want to add that lift, then do, but maintain that neutral positioning. Breathing in as we slide in. The left leg, the right hand slide along and they reach away, abdominals pulling in. Breathing in as we draw in, and then right leg, left hand slide along and we lift. Breathing in as we slide in. One more each way. So left leg, right hand slide along. Reach them away as we lift. Breathing in, sliding in. And the last one. Left leg, left arm, right leg. And we reach my rights and lefts of pants. Pause and then drawing all the way back in. Okay. So staying on all fours for our last one. Again, just making sure we are in our neutral. If you just need to do a quick reset, then of course you can do. So we're going to tuck the toes underneath you. Now we're maintaining that neutral position. Breathing in, press down into the toes as we hover the knees just an inch or so away from the mat. Breathing in as we lower. This is my absolute favourite stability exercise, this one. Breathing out as we hover, maintaining that neutral. Breathing in as we lower, and again, breath out, hovering the knees up. Breathing in as we lower, and then 2 more. Breath out as we hover. Breathing in to lower back down, and the last one, hovering away. And releasing back down, and then just have another quick sit back, have a little shell stretch, give those wrists a little roll out, a little release there if you need to, and then we can uncurl the spine back up. All right, well done everyone. I really hope that you enjoyed my Pilates for Scoliosis workout, and I really hope that you found it useful. If you did, please do give the video a thumbs up, and don't forget to subscribe so you don't miss any further workout, guys. All right, I look forward to seeing you all in the next video. Take care everyone.